Welcome to Transcultural Communications, Transcultural Building Blocks, Chapter 4. Let's recall from Chapter 2 that transcultural communication is built first of all on culture. Culture in turn forms the basis for values, which are cultural values, and we will explore these cultural values in this chapter. Cultural values support the beliefs and behaviors that are accepted within each culture. Beliefs and behaviors in turn influence communication patterns, both verbal and nonverbal, within different cultures. It is vital as roles in professional caregiving that you would come in contact with people from many diverse cultures and walks of life. To provide cultural competent care, you must recognize and accept patients with different belief systems and styles of behavior. You must also be able to speak with patients who have different communication styles and who have limited proficiency in English. The first thing we will be looking at in this chapter is health belief systems. The three major types of health belief systems are biomedical, supernatural, and holistic. For this slide, we will look at biomedical belief system. This arose from a teaching of René Descartes, a 17th century philosopher. She believed that each person is a body machine. This theory produced the concept that a person of dualism or a body dichotomy. This is, the mind and the body are separate from each other. According to this model, disease is caused by physiological disturbances such as genetic disorders, biochemical imbalances, and infectious organisms. Pathologic alterations in tissues construct evidence of disease. As a result of their biomedical training, biomedical practitioners pay primarily attention to the physical complaints and the pathological changes in someone's body. At the same time, these practitioners de-emphasize mental and emotional problems and the psychosocial component of disease. Traditional treatment usually involves administration of medicines or performing surgery. Western physicians have introduced biomedicine into numerous cultures around the world. This belief system continues to dominate diagnostic and health care throughout the U.S. The next health belief system we will look at is the supernatural. It is widely accepted in traditional Hispanic, Caribbean, African, and other cultures. It differs dramatically from the biomedical model. Cultural groups that believe in the supernatural model may view illness as a sign of weakness, a punishment for evil doing, or retribution for shameful behaviors such as disrespect toward elders. Some cultures also believe that illness results from the possession of the body by evil spirits, or even the casting of evil spells. Some groups practice medical pluralism, which is relying on Western medicine for also using traditional healers to help heal the person. Treatments can include prayer, sorcery, magic, witchcraft, religious rites, masks, sand paintings, and many Westerners use supernatural beliefs in so much as they turn to God or a saint to help heal an illness. The third health belief system is the holistic belief system. It is primarily upheld by Asian cultures and some Native American cultures. Although holistic beliefs have started to infiltrate traditional Western thinking. Americans are disenchanted with the biomedical emphasis on technology, medications, and curing illness, and a growing number of Americans are now interested in the concept of holistic medicine, with its emphasis on health promotion. Unlike Western medicine, the holistic system emphasizes illness prevention and health maintenance. The major premises of this system is that there are natural laws that govern everything and every person in the universe. To be healthy, a person must remain in harmony with the natural laws and be willing to continually adjust and adapt to changes in the environment. According to this system, illness develops when one does not properly care for the body. For example, we subject ourselves to too much cold, too much heat, or too much alcohol, or an improper diet. In essence, illness results when a person fails to act in harmony with nature, causing vital elements within the body to become imbalanced. The Chinese culture refers to these elements as yin and yang. Hispanic and Eastern Mediterranean cultures groups use the terms hot and cold. Too much of either of these elements, yin and yang, heat or cold, causes illness. To restore health, the person must restore equilibrium to the body. So in other words, if a person has a fever, then they would apply a cold compress and eat cold foods. There are 4 healthcare systems that are related to the health belief systems just described. The first one we will look at is the biomedical healthcare system. This combines Western biomedical beliefs with the traditional American values of self-reliance, individualism, and aggressive action. It's designed to conquer disease and old age, based upon the American concept of mastering one's own fate and dominating nature. In recent years, it has incorporated disease prevention and health promotion. It encourages people to learn as much as possible about their condition, as well as doctors being open and honest about their prognosis. In Japan, doctors are hesitant about being open because they don't want to remove the potential for hope. Where in Bangladesh, a doctor would tell a patient to eat whatever they want to subtly convey the truth of their diagnosis. Western patients are taught self-care, especially with medication and wound care. In Asian countries, the patient's family is taught these skills because of their group orientation. The next healthcare system we will look at is the popular healthcare system. This focuses on self-treatment, over-the-counter medications or home remedies. For instance, going to the drugstore and buying a cold remedy, or something for upset stomach, or trying home remedies that your culture and your family, like your mother, may have said that this works. The first type of care most people go to, no matter what their culture, is the home remedy treatment. Only when these treatments fail does the person call their doctor. Also, they form the basis for groups such as Alcoholics Anonymous and support groups. The third one is folk or traditional medicine. These would include herbalists, acupuncturists. The goal is to treat the whole person within the context of the family. Considerations of a social, physiologic, and spiritual dimensions of the patient are also kept in mind. However, folk healers have a high status in their culture, and many patients incorporate folk medicine either before or after biomedical health interventions. Another system is the alternative healthcare system. Although they vary greatly, alternative medical practices have two common traits. They differ from biomedical beliefs, and they evaluate success differently from biomedical research methods. Practitioners of alternative medicine include chiropractors, homeopaths, naturopaths, and hypnosis. Examples of alternative healthcare are diet therapy, which is macrobiotics and megavitamins, mind-body control methods, which include relaxation, counseling, prayer, hypnotherapy, and guided imagery. Also, body structures and energy. These include chiropractic, massage, and therapeutic touch. Pharmacological and biological therapies that include antioxidants, which is the removal of free radicals that can kill off healthy cells, oxidizing agents, which will kill bad cells, like using peroxide to clean a wound, and gelatin therapy, which is the removal of heavy metals from the system. Many Americans are choosing to try alternative medicine. Let's take a look at a research study that showed that statistics based on a 1998 study, 42% of adults use some form of alternative care within the previous 2 years. 74% of adults used alternative care and biomedical care, and 15% of adults replaced biomedical care with alternative care. Culture dictates what is acceptable behavior when sick. Identifying what is acceptable behavior within your patient's culture will help you understand your patient's reaction to illness. In some cultures, like Asian and Native Americans, patients are expected to be stoic and silent when in pain. On the other hand, within the Mediterranean culture, it is acceptable to express pain and loud complaints and dramatic gestures. Culture also influences whether a person is willing to talk about symptoms or emotions with care providers. For instance, Asian cultures typically value a subtle approach to problems and the restraint of strong feelings. Thus, Asian patients may find it difficult to speak openly with strangers about symptoms or emotional problems. In middle-class white Americans, they are raised in a society that values open expression. They may welcome an opportunity to frankly discuss their symptoms with healthcare providers. Every culture has standards for verbal communication, especially for word choice, the degree of emotion considered appropriate, volume and speed of speech, inflection, directness, and the use of silence. Let's take a look at some verbal expressiveness examples of behind the different cultures. In white Americans, controlled tone and emotional restraint is considered appropriate. Americans from the South, Asian and Native Americans, tend to speak more slowly. White Americans of Mediterranean descent tend to be loud and dramatic. Black Americans, emotional expressiveness is valued. Loud volume is not aggressiveness. And Americans tend to be very direct in their speech, almost impatient sounding. In verbal expressiveness, Mexicans can tend to be overly polite, diplomatic, and tactful. They engage in small talk before getting into an important discussion or conversation. French, Spanish, and Eastern European cultures interpret silence as a sign of agreement. Americans use eye contact as a measure of honesty and integrity. Asians and Native Americans believe that prolonged eye contact is rude and invades one's privacy. Muslim women avoid eye contact to ensure modesty. And in India, eye contact depends upon one's social position. People of differing social economical statuses do not make eye contact. The amount of personal space that people need as a comfort zone varies from individual to individual and from culture to culture. For Western culture, research has identified the following 4 zones of interpersonal space. The first one is intimate space. This is up to 18 inches, and this is reserved for people who are in close relationships. Medical professionals must invade this space because of treatment plans. Personal space is from 18 inches to 4 feet, and it is reserved for space between friends and patient counseling. Social space is from 4 to 12 feet. This is used in everyday business. And public space is greater than 12 feet, used in lectures and speeches. Americans are very particular about their personal space, whereas people from Latin America, Africans, Arabs, and French people prefer to stand close to one another when talking.